Hi, my name is Melissa Brown, and I'm doing a heart and peripheral system assessment today. Prior going into my patient's room, I have checked the medical record for any hypertension, cholesterol problems, any heart disease, or any murmurs. I have gathered all my necessary supplies, and I will go into the room. Prior to entering the room, I washed my hands. I will use gloves if needed and PPE. And I will identify my patient and introduce myself. Hi, I'm Melissa. I'm going to be your student nurse today. Can you please tell me your name and date of birth?
Chase Anderson, and October 13th, 2007.
Okay, thank you for that. And it matches the ID band. Okay, I provided privacy also. I will now explain to my patient the procedure we're going to be doing. We're going to be checking your heart today and some of your arteries and veins throughout your body. Is that okay with you?
Yes.
Do you know what your heart is?
Pumps blood through your body.
Oh, very good. Okay. And if you could sit still for me. Do you have any coughs right now?
No.
Do you have any shortness of breath?
No.
Do you know what shortness of breath is?
You can't breathe that well.
Okay, so you don't have no shortness of breath. Okay, are you tired at all?
No.
Do you take any medications?
No.
Okay, and how's your activities? Do you get outside and play for about 30 minutes a day?
Yeah.
Okay, that's good. Okay, during this assessment, I'm going to be using this. This is a stethoscope. And I'm going to be assessing different parts of your heart. Clean it with some alcohol. And like I said, I would put gloves on if needed. Also, another thing I would check for my patient, but not for a child, would be if they use any drugs, if they drink any alcohol, or if they smoke. So, okay, let's move right on in. I would have the patient lay down.
Okay.
This is how I would assess for any heaves or lifts near the apex of the heart, right sternal border, and I would feel and palpate with my hands and also inspect and look. If you could see them present, it could mean that the patient has an enlarged heart or another condition. I see no signs of any heaves or lifts noted. Also, when my patient is laying here, I would then check for any jugular distension, which is the veins on the sides of your neck. I see none noted. If I did see some noted, I would then have the patient come up, sit up just to a 45-degree angle, and then I would check again. No jugular distension is noted. Okay, and you can turn back around straight for me, please.
Yeah.
Then I would go into auscultating with my diaphragm of my stethoscope. First, I would check on the right sternal border, second intercostal space. I would know my intercostal spaces by feeling in between. One, two, and here's where I would check the aortic valve. Okay, sounds normal. Rate is normal and strong. Then I would go to the left sternal border, down to the second intercostal space to listen to the pulmonic valve. Rate is normal and strong. I would then go down 2 more spaces, 1, 2, on the left sternal border as well, to listen to Erb's point for any murmurs. I hear no swishing or any signs of any murmurs. Could you hold still, please? Then I would go down 1 more to the tricuspid valve. Strong and rate is normal. Then I would move down just below the breast which would be the 5th intercostal space, mid-clavicular. This is where you listen to the apex of the heart. This is the point of maximum impulse. This is also where you can listen for the mitral valve. Okay, and it sounds nice, and the rate is normal and it's strong. If there was any abnormalities, I could listen longer or do other tests. S1 and S2 was noted, and S1 and S2 is the lub and the dub of your heart, the lub dub, S1 and S2, they were both noted. And so now I will check your carotid pulse one at a time. The lower third of the neck. And it is present, and you would not do both pulses at the same time, so you don't occlude the arteries. And it is present and strong, and it feels normal on both sides and equal. This is also where you would listen for a bruit, which is like a swish on the carotid artery, and you would use your bell of your stethoscope. You would listen to the upper, middle, and lower third of the neck on both sides. And during just jugular distension checks, during the bruit check, I would have the patient hold their breath. Okay, and now I will go into assessing the patient's skin for warmth and texture, and hair is nice and evenly distributed. It is warm and dry. The skin is pink with pinky undertones. I will then check both radial arteries. They are both present and equal bilaterally at a +2. I would then check capillary refills on the middle 3 fingers, which it is brisk and refills under 3 seconds on both sides. Okay, and now I would go into assessing the legs for warmth. Can you hold them straight up? You can turn sideways actually for this.
Oh.
Yep. That's okay. Okay, and they are both warm on both sides. I don't see any masses or lesions. They are pink. The hair is evenly distributed. I could check the capillary refill on the middle toes. It is brisk on both sides, less than 3 seconds. I would then check the duralis pedis pulse, because you want to start from the bottom up to the top. They're both present. Then I would check the posterior tibial pulse. They are both present and equal on both sides. Pulses were at a +2. You can also check the popliteal pulse behind the knee, the femoral pulse in the groin, other pulses in the upper body. You could do temporal, the carotid, axillary, brachial, and the radial. And I think that might be it. Do you have any questions for me?
No.
Okay, I would then document everything, wash my hands, remove any PPE. I would make sure my patient is comfortable and that they have their call light in hand, and make sure they're comfortable. Do you need anything?
No.
Okay, well, thank you for your time, and that completes our heart and peripheral system assessment. Thank you.